Meet patient Pierre. As you can see, Pierre suffers from chronic pain due to his cancer. In addition to the severe chronic pain, he is also refractory to other treatments such as systematic analgesics, adjunctive therapies, or intrathecal morphine. Thus, the question arises, are there any pharmaceutical drugs that can help Pierre with his pain? Now, keeping this in mind, let's travel to the Pacific Ocean to the islands of the Philippines, where Baldomero Oliveira and Michael McIntosh studied the infamous cone snail, Conus magus, also called the magician's cone or beluso as it's known locally. Found in parts of the Indian and Pacific Ocean in both tropical and temperate waters, these organisms are found in both shallow intertidal waters as well as great depths up to 1,000 meters. So, what is so unique about these deceptively insignificant tiny snails that do not even exceed 1 centimeter when fully grown?
The cone snail can immobilize their prey using unique venom. Their venom includes conotoxin, which is so potent that the venom from a single cone snail can be lethal for up to 700 people. Therefore, a single sting from Conus magus can be fatal. This venom is used by these predatory snails to immobilize their prey, which usually consists of small fish, marine worms, or other mollusks. The snail uses a harpoon which includes the proboscis, which stretches out like a tongue. It is coated with a venom to stun, paralyze, and capture its prey. Within its shell is a venom bulb which acts like a pump to deliver venom through the venom duct into the harpoon, injecting it into the prey. Finally, the rostrum acts like a mouth, engulfing the prey in one big gulp. Now, the cone snail must recover for its next hunt by reloading the proboscis with new venom so it may stun its next prey.
Baldomero Oliveira, a Filipino neuroscientist at the University of Utah, was always fascinated by the beautiful cone snails he saw at his local seafood market back in the Philippines. His discovery of the potency of the venom of these marvelous creatures back in the 70s caused him to pass on this fascination along to his colleague, J. Michael McIntosh, a freshman starting to work in his lab.
Michael McIntosh rapidly discovered a cone snail toxin that can kill people and began to purify the peptides in the venom to test their effects. It took about 2 decades of tireless effort for the resulting pharmaceutical version of the venom peptide named seconotide to be approved for sale. Finally, in 2004, Prialt was born.
Before we speak about the mode of action of seconotide or Prialt, let's first have a short overview of what pain means in the body. In order to understand chronic pain, we have to understand how this differs from acute pain. Acute pain is a normal experience that is usually short-lasting and serves to alert the body about ongoing tissue damage. However, chronic pain is long-lasting and can persist in the absence of any tissue damage. So here we don't always know the stimulus of the pain. So let's first see what acute pain does to the body. In pain signaling, there is the ascending pathway in which signals travels towards the brain and a descending pathway in which signals travel away from the brain. Imagine you hurt yourself or some kind of trauma happens at the side of the skin. Now let's zoom in and see what happens. There will be an immediate inflammatory response by the release of a lot of pro-inflammatory chemicals such as cytokines and prostaglandins and by attracting cells such as macrophages and neutrophils. Then there are sensory nerve fibers which respond to the chemicals that will increase the pain signaling and can lower the threshold of the action potential. These pain neurons are called nociceptors and belong to the first order of neurons. Next, the signal travels towards the spinal cord. Here you will see how the spinal cord is located within the intervertebral column. The spinal cord is important for signaling information about things such as pain, temperature, and pressure, and for connecting the peripheral nervous system with the brain. So as the signal continues to travel up, it enters the brain. There are parts in the cortex of the brain, which is the outer part of the brain, that are associated with sensation, or the feeling of touch. This area is called the somatosensory cortex. Within this area, there are specific sites related to the different parts of the body. Let's go back a little bit and focus on where the signal is processed within the spinal cord. Here you will see a cross-section of the spinal cord. The back side is called the dorsal horn and the front side is called the ventral horn. In the middle we have the central canal. After the pain signal comes from the nociceptors, it enters the dorsal gray horn where it meets the second order neuron. And important here is that the signal crosses from the left side to the right side of the spinal cord and goes up to the brain to tell you you're experiencing pain. We will now have a look at the communication between the first and second order neuron, as this is also the site where the drug ziconotide plays an important role in blocking the pain signal. This communication is chemically mediated. Here the top neuron can be an A-delta fiber, which is myelated and corresponds to localized sharp pain, or a C fiber which is unmyelated and corresponds to slow and poorly localized pain. This fiber releases a whole bunch of neurotransmitters into the synaptic cleft, including glutamate, substance P, CGRP, cytokines and chemokines, and these chemicals bind to the receptors onto the next pain neuron, the dorsal horn neuron. But for us, glutamate is important in this case, as this is a powerful excitatory neurotransmitter. This glutamate can be stimulated by the influx of calcium into the first neuron. Now that we understand the big picture of acute pain, let's see how chronic pain is caused. Next to the synapse between the first and second order neuron are often glial cells like astrocytes located. They maintain the microenvironment in which these two neurons are. When they sense that a signal is being sent, they will release more substances such as cytokines to amplify the signal. So even if you stop the stimulus at the site of the trauma, this little microenvironment can continue as a positive feedback loop and amplify itself. And as mentioned earlier, these chemicals can lower the threshold of the action potential, meaning that even a little touch can stimulate the pain. And so this feedback loop is one of the main reasons as to why chronic pain occurs. So now that we have seen that chronic pain can actually be very problematic as it can amplify itself, there is a need for drugs such as ziconotide. So let's see where ziconotide interferes with the chronic pain signaling. It is believed that the drug binds to the alpha-2 delta subunits of N-type calcium channels in the dorsal horn. It blocks the influx of calcium ions into the secondary neuron. This reduces the release of pain neurotransmitters, mainly glutamate, from the primary nerve terminals into the synaptic cleft. And finally, this will reduce the pain signal going towards the brain to tell you you're experiencing less pain. Ziconotide is the synthetic analog of the omega conopeptide. It consists of a 25 amino acid chain with 3 cysteine disulfide bridges causing 4 loops. Tyrosine 13 is here a critical component in blocking the N-type calcium channel. The substance is prepared by a process called solid-phase peptide synthesis. The way peptides are synthesized in a lab is quite different from the way organisms synthesize proteins. Our body synthesizes from the terminal amino end towards the terminal carboxyl end. However, in solid-phase peptide synthesis, it is the other way around. In the production of the compound, we also have to use several activating and blocking agents to promote each reaction. For example, tert butyl oxide carbonyl, or TBOC, is often used as a blocking agent, whereas dicyclohexylurea, or DCC, can be used as an activating agent. These are attached to each amino acid. In solid-phase peptide synthesis, first an amino acid that has been blocked by TBOC is attached onto a solid surface. In the second step, the TBOC is being removed in order to make space for the next amino acid to be attached onto the chain. Because in the next step, the new amino acid that has been blocked by TBOC and contains the activating agent DCC will be added to the reaction. In this addition, the activating agent leaves the reaction. Then this step process is being repeated until the chain of interest is being completed. At the end of the synthesis, the protein is being released from the solid surface by adding hydrofluoric acid that breaks the carboxyl ester bond. The last protective group is also being removed, and finally the compound is being converted into the acetate salt and purified to obtain the end product, ziconotide.
Prialt is a non-opioid, non-narcotic analgesic that is used to treat ongoing pain when other treatments or medications have failed to do so. It is used to treat chronic pain caused by illnesses such as cancer, AIDS, failed back surgery, multiple sclerosis, neuropathy, etc. Although this medication is extremely strong, there is little chance for addiction as it is a non-opioid, unlike morphine and other painkillers.
As mentioned earlier, Prialt works due to the action of ziconotide blocking the nerves in the spinal cords that send the pain signals. Thus, Prialt has to be intrathecally injected directly into the spinal fluid. No other means of delivery is possible as intravenous injections can cause fainting due to a dangerous drop in blood pressure.
Prialt is injected into the spine using a small pump that releases a dosage gradually into the body. In order to decrease the risk of side effects, treatment is usually started slowly at 2.4 micrograms a day and then gradually increased to the best dose, which cannot exceed 21.6 micrograms per day. This is determined by the doctor based on the condition that the patient faces and the responsive therapy.
The dosage is carefully determined in order to reduce the side effects of Prialt, which include dizziness, drowsiness, nausea, headache, weakness, joint pain, sleep problems, unusual dreams, stomach pain, diarrhea, constipation, loss of appetite, urinating less than usual, or loss of balance or coordination. Prialt also interacts with other common drugs in the market for allergies, colds, seizures, diuretics, and many more, and is therefore only available with a prescription. Because the number of patients who have long-term pain that requires painkillers to be injected directly into the spine is low, the disease is considered rare, and in 2001 Prialt was designated an orphan medicine, that is a medicine used in rare diseases.
After rigorous testing, Elan was granted marketing authorization valid throughout the European Union for Prialt in 2005 under exceptional circumstances. It was originally authorized under exceptional circumstances because, as the disease is rare, limited information was available at the time of approval. As the company had supplied the additional information requested, the exceptional circumstances ended in 2014. Despite being an orphan drug, Prialt has been valued between $25 to $31 million by Elan, the pharmaceutical company that owns it, making it a profitable drug to have valorized. Now, let's go back to Pierre. As Pierre has not reacted favorably to other painkillers and even has a history of substance abuse, making opioid drugs like morphine a dangerous drug to prescribe, doctors felt that Prialt would be ideal for treating his chronic pain and are now checking to see if it could react to any other drug that has been prescribed. They notice that he consumes sleeping pills and recommend that he discontinues this in order to commence Prialt. After a few weeks, doctors have decided on the optimal dose for Pierre, and although he experiences its side effects, he feels much better. And all of this can be attributed to a team of chemists and biologists who saw the potential of a little cone snail in the Philippines.